I felt that same pit in my chest again that I'd felt when I got diagnosed, actually. And then really quickly I had to flip the switch and remind myself that this isn't about me. Like, that the patient that I'm about to walk into, I'm sure that they would appreciate hearing my story, but they have their own story. During the summer between my freshman and sophomore years of college, when I was 19, I was actually playing a lot of golf and trying to work my way as a walk-on onto the IU men's golf team. I felt a pull, and I actually thought that I'd given myself a hernia, and upon a self-check, I felt a really hard mass or a lump, and at the time I didn't want to believe that it could be cancer, because at 19 you don't think that that can happen to you. So for lack of a better term, I just went into denial about it, told myself, oh, it's fine, it's nothing. And the pain just continued to become more and more debilitating, to the point that I couldn't swing a golf club, and then I couldn't run, and then I found it harder to raise my left leg and walk, just because of the mass effect of it. So before I had ever been diagnosed with testicular cancer, I had actually taken a class at IU Bloomington called Biological Processes and Drugs through the Hutton Honors College. And an entire segment of that course was spent talking about cisplatin and how this Dr. Lawrence Einhorn had developed this groundbreaking chemotherapeutic regimen that really transformed testicular cancer from a death sentence in young men to a highly curable form of cancer. So during my fourth year of medical school, actually just a few months ago, I was on an elective rotation at the Simon Cancer Center, and I remember I was with a physician for the day, and this physician had told me to go see a patient. I look at the door that I'm about to go into to talk with this patient, and I just stop for a second, and it hits me that this was the first room that I was seen by Dr. Einhorn in when I was his patient. Same clinic, same room. I was just on the different side of the door, the opposite side of the door. Yeah, so my experiences with cancer have definitely shown me and allowed me to experience firsthand how terrifying the unknown of a diagnosis can be. And I never want to compare my level of empathy with the level of empathy of any of my colleagues or any other physicians, but I know that personally, I know that the level of empathy that I can show to them now is infinitely more than what it could have been had I not gone through this experience.